My name is Dr. Maria Diaz-Gonzalez de Ferris.
Dr. Alexandra Bicki.
Glenn Chertow.
Gary Curhan.
Christine Limonte.
Alison Potok.
I was funded in 1989 as probably the first generation of CSN fellows.
I completed the Clinical Scientist in Nephrology Fellowship during the 2023 to 2024 academic year.
From 1993 through 1995.
I was in the second year. That was 1990 to 1992.
Between 2021 and 2023.
From 2019 to 2021.
I prepare adolescents and young adults to self-manage their health as they get ready to move from the pediatric care to the adult-focused health services.
My specific patient population of interest is those adolescents and young adults with chronic kidney disease that are progressing toward needing dialysis or kidney transplantation.
I would say I spend about half of my time caring for patients and about half of my time doing research and teaching.
My clinical focus is diabetic kidney disease. I have been successful in obtaining an independent research award, so I am dividing my time between doing clinical research and seeing patients.
I am an assistant professor of clinical medicine, and I see patients at the VA as well as at the university, and I also follow patients on dialysis.
The patients that I see are only kidney stone patients, and that still relates to what I was doing when I was a CSN fellow decades ago.
Thanks to the funding of the American Kidney Fund, I was able to not just complete research in the areas of interest, but also was able to complete a PhD in epidemiology. I've published over 225 peer-reviewed publications. I continue to mentor trainees of all disciplines. I developed this niche of healthcare transition, and now I'm the director of the program. We are among the world leaders in this area, if you don't mind me saying so.
My original research aimed to identify facilitators and barriers to both home dialysis and living donor kidney transplant for adolescents and young adults with kidney failure. I successfully applied for and was awarded an NIH F32, so an individual postdoctoral fellowship, immediately after that first year of AKF funding, and began to expand on that work.
The CSN is what launched my research career in kidney stones. It allowed me to do research, to have a dedicated time, but it also allowed me to get my Master's of Science at the Harvard School of Public Health and Epidemiology, which subsequently I was then able to go on and get my doctorate.
Over the course of my career, I've done anything that I thought I could do to improve the lives of patients with kidney disease. And so I think the work that I began as an AKF CSN fellow laid the foundation for much of the research methods that I've used and that my own trainees have used over the last 30 years.
In those 2 years as a CSN fellow, I was able to establish mentorship, connections, collaborators, and really start to gain recognition in the field.
This fellowship provided me with protected time for research, which allowed me to hone my skills in epidemiology and biostatistics, and also to increase the number of publications. I know I could not have successfully secured a K23 award without it. And so now I'm mentoring trainees with their research projects. I have been working with medical students throughout the country, collaborating with senior scientists around the world.
I've done works in a huge number of different areas in nephrology and really had a huge impact, particularly for the mission of the AKF being focused on the patient. I just can't emphasize enough. That's what touched me from the beginning. And can the CSN to connect all this together? The goal is to improve care of patients with kidney disease and their quality of life as well.
You know, I would never have thought that this little Mexicanita who immigrated to the U.S. with lots of dreams and hopes would get her dreams and hopes realized thanks to the seed funding of the American Kidney Fund.
I think it created a dedication to training the next generation of kidney medicine researchers.
There is this network of, if a person that wants to apply for the fellowship, or even once they get it, that they would want to contact us and say, I'm an AKF CSN fellow, that completely changes how we would interact with them and, want to do whatever we can to help be sure that they're successful.
And I think the CSN program provides a crucial opportunity to junior investigators like me who have not yet had the time to build a strong bibliography and to find their research niche.
Fostering the careers of young trainees in the field is very important because we don't have enough people joining pediatric nephrology and nephrology to meet the demand.
Pursuing a career in research is challenging. There's many costs associated with clinical training. Programs such as the AKF CSN program can really give people who are just testing the waters in terms of research an opportunity to try out something new and develop this important skill set.
This program is something for which I have always been extremely grateful.
The CSN program really propelled me into this exciting academic career, and I'm incredibly proud of the time I was supported by AKF.
If not for the AKF CSN program, I wouldn't be here today.
And now here I am, 36 years later, a successful academician and a very happy and proud physician.